How to tell expiratory versus inspiratory wheezing in COPD. Wheezing sounds can be alarming, especially if you or someone you know has chronic obstructive pulmonary disease. Understanding the difference between expiratory and inspiratory wheezing can help you identify the severity of the condition. Wheezing is a high-pitched, whistling sound that occurs when the airways are narrowed or obstructed. In chronic obstructive pulmonary disease, expiratory wheezing is the most common type. This type of wheezing happens during exhalation, which is when a person breathes out. It typically indicates that there is difficulty releasing air from the lungs. This is often due to narrowed small airways, inflammation, or mucus buildup. When someone with chronic obstructive pulmonary disease exhales, you may hear a distinct high-pitched sound. This is a sign that the airways are constricted, making it hard for air to flow out. The loss of lung elasticity also contributes to this difficulty. On the other hand, inspiratory wheezing occurs during inhalation, which is when a person breathes in. This type of wheezing is less common in chronic obstructive pulmonary disease. If it does occur, it may suggest more severe airway involvement or even obstruction in the upper airways. Inspiratory wheezing can sometimes be associated with conditions that cause upper airway blockage, such as stridor. Most of the time, expiratory wheezing is more prominent in chronic obstructive pulmonary disease. This is because the disease primarily causes airflow limitation during exhalation. If inspiratory wheezing is present, it may indicate more serious airway narrowing or complications that need to be evaluated. Healthcare providers often use a stethoscope to listen to the lungs during both phases of breathing. If wheezing is mostly heard during exhalation, it supports the diagnosis of chronic obstructive pulmonary disease. However, if wheezing is detected during both inhalation and exhalation, it may signal a more severe condition or an exacerbation of the disease. Understanding these differences is essential for assessing the severity of airway obstruction in chronic obstructive pulmonary disease. It helps guide treatment decisions, as wheezing is linked to symptom severity and lung function decline. Expiratory wheezing typically indicates the usual airflow limitation seen in chronic obstructive pulmonary disease, while inspiratory wheezing may prompt further evaluation for upper airway issues or other complications. In summary, expiratory wheezing occurs when breathing out and is common in chronic obstructive pulmonary disease. Inspiratory wheezing happens when breathing in and is less common, possibly indicating more severe airway problems. Listening carefully during breathing can help identify these sounds and guide appropriate care.